So how many fibroids did they remove?
13.
13
of different sizes.
13 of different sizes.
Yes, and there's something I forgot to mention that during pregnancy, it actually increases.
Okay. During pregnancy, the size of the fibroids
Will increase because I had the hormones, the pregnancy hormones. When you're pregnant, there's this surge in hormone. I think it's estrogen also, but those pregnancy hormones also encourage the growth of fibroid. Even though the baby's presence will try to suppress it, but the fibroid still grow.
grows.
So definitely after pregnancy, the sides were still big.
Hello, welcome to my channel. Welcome to Journey with Judy. Today we have our guest in the house. Yes, if you have been following us, you know that there's this faceless guest that has talked about her fibroid experience, how she knew she had fibroid, and how she became pregnant with fibroid, her experience with the pregnancy, how the whole experience with the fibroid and pregnancy and after childbirth. So today we still have her on our channel, and she'll be telling us her surgery experience, because she had to go for surgery and she's here on our channel to tell us her experience. Hello, welcome to our channel. Thank you for coming.
Thank you very much, Judy. It's nice to have you again. Thank you.
So today, can you please tell us, in the last video you said something about going for surgery. So can you tell us how the whole stuff went before you went for surgery? Were you told anything, the surgery, and after the surgery?
Okay, thank you very much. Like I said, I was very confused at some point because I heard lots of things and I didn't know which option to go for. But there's one thing I noticed after delivery, my flow became really, really heavy.
After delivery?
Yes.
Before delivery? Before you became pregnant, rather?
Yes.
How was your flow?
I would say it was heavy, but it was I just thought it was normal because
Okay.
I didn't know the difference between heavy and normal though. But I just felt it
So
was.
after delivery?
Yes, when my periods returned, I
Okay.
noticed that it was really, really, really heavy.
So can you tell us when your period returned? Hope I'm not going too deep.
Yes, I discovered that my period became really heavy after delivery. Like it was really, really heavy.
Okay.
Yes.
So before you became pregnant, it was heavy, but not like after you delivered your baby, it became heavier.
Yes, I would say it became heavier because ordinary before I got married, it was heavy, but I didn't really see it as a big deal. But after delivery, I noticed that
The flow was just.
the flow was just really, really
So
heavy.
after you gave birth, like how many months before you started seeing your period?
No, I can't say months, so just a month and some weeks. Yeah, that early.
Let me get you right. After you gave birth,
Yes.
when did you start seeing your period?
I would say 6 weeks or earlier because
6 weeks.
initially I thought it was still the normal post delivery, postpartum
Are you
spot,
serious?
which I've forgotten the name they call
6
it.
weeks is a month and 2 weeks.
Yes. So
Wow.
I think 5 or 6 weeks thereabouts. So but I asked the doctor, I said it's normal. It happens in some women,
Are you
yes.
serious?
Yes. So yeah, that was it. So he said I could come after 6 months to remove it. Although one other doctor said no, that you have to wean your baby first, that is a major surgery, and that you have to wean your baby first because at that day you cannot even
Breastfeed your baby.
And I was hearing lots of stories. One other doctor even told me, see, how much you are not even pregnant. He said that what he would do for me is just to manage it. And then when it's time to deliver, they could do a CS. They call it a cesarean myomectomy. That's a CS, and then they remove the fibroids. But then my guy he told me he was not going to do that option, even in my
So
first
I wanted to
pregnancy.
ask you,
Yes.
why didn't they remove it when
Yes.
you?
Okay, yes. My guy said he was not going to do that. That because it's very risky. That it's better if you can deliver naturally, you deliver, and after some months you come back and do just myomectomy. That during the process of a cesarean myomectomy, a lot can go wrong.
Okay.
There could be so much loss of blood, lots of complications. And I spoke to several doctors, and they told me the same thing. But the one other doctor was telling me he can do it. But someone has said,
The
don't even
risk.
listen to him. The risk is so it's better you just so for if you're in my if you're having this kind of difficulty, if you can, please deliver your baby. Except maybe they can't deliver that baby without removing it. Because I have a friend who they had to remove. In fact, it was just one they removed. She had multiple fibroids, but they removed just one because they couldn't even remove the baby via CS.
Okay.
So they didn't even tamper with the other ones because the life of the mother is very important. So they removed just one and then delivered the baby and then stitched her back and told her when you recover, please come back and remove the rest.
Yeah.
So initially, personally, I was also thinking of going for a cesarean myomectomy because I'm like, why should they want to open me two times? Why not just do the CS, remove the baby? And the doctor said, you patients don't understand. It's better they tear you two times and then
Yes. To be on the safe side.
yes, be on the safe side. So I said, okay, no problem. After 6 months, my baby was too small, so I decided to give my baby more time. I think after 8 months or thereabouts, I felt maybe my baby, and then my doctor assured me that I could still breastfeed
Okay. After
the myomectomy. So that was actually what even gave me the because initially I was delayed because I was like, I can't meet my baby, I don't want to meet my baby now. But my doctor told me you can breastfeed. There's no I'm like, okay, fine. I made up my mind. It wasn't easy, I must say. It
Okay.
was
And she was 8 months.
yes, it wasn't easy because it took me a lot of prayers, thinking and everything and we sought advice and then made up our mind. I and my husband said, okay, let's go for this. And the very day I went to the hospital, I just wanted to discuss my gynae. I didn't tell him I came to get a date. He just said, I'll book you in 2 weeks in 2 weeks. Send me for a PCV. That was called right blood level and we need to check if your PCV is okay because we need to know if you need transfusion and the rest. And so I went for the PCV. I brought the results. Said okay, he wrote the date. Okay, so I'll come on this date. We'll do the myomectomy and just keep 1 pint of blood. I'm like, okay, 1 pint.
One.
Yes. He said it to be
And
enough.
your previous video, you said something about 4 pints
Four
of blood.
pints, yes, but he said I should just keep one down.
One.
My PCV is okay.
So when they told you to keep 4 pints of blood, was your PCV not okay?
I don't know. Maybe because I think that was because we're going to do a cesarean myomectomy.
Okay.
It's different from an ordinary myomectomy.
Okay.
Because imagine that you first of all do a CS to remove the baby.
Maybe
Then
the
you now
fibroid.
start. I know that myomectomy involves removal of the uterus.
Okay.
So the uterus is removed and then carefully the myomas, the fibroids are removed. So it's better if that one is just it's better you're doing just that one than you're doing combining it with. So I think that's why they said I should keep 4 pints. But this time around, I said I should just keep 1 pint of blood.
1 pint. Wow.
Yes, so and I should come a day. Normally I was supposed to come 2 days before, and that so that I could get admitted and know the necessary things. So I went on a day to the procedure. I went to the hospital and already they sent me for some other tests too, not just the PCB, but some other tests too, which I did and gave them the results and basically that was it. It wasn't easy still. I was a bit tense, but when I was in on the ward, I met other women too that had done and told me it's not a big deal. It's something that you can do and you'll be fine. I said, okay, so well, I just believe that I was in God's hand and on the day I went into the theater. Do you want to hear the experience too?
Sure.
Okay. So on that fateful day in the morning, my doctor had come and then I was taken to the theater. Before then, someone from the theater came and prepped me on all I needed to know. Don't eat after 10 p.m. the day before. Don't eat. That's what the things that could happen. They told me that after the whole procedure, I shouldn't use a pillow because it could result into headache and so many other things which I can't even remember now. So I said,
Okay, so don't eat, don't take fluid,
yes, after 10
don't
p.m.
eat after 10 p.m. a day
Yes,
before,
a day before.
and after the surgery, you shouldn't use pillow.
You shouldn't use pillow because I guess it's because of the is it anesthesia they call it that they give you in your back. There's this spinal injection they give you too so that you don't feel pain. So I got to the theater. They tried to like find a line so that they could fix a line for me. I don't like cannulas. The bad thing about this kind of thing that they use green cannulas. If you've been in the hospital before, you know that green cannula is very long. So I actually don't like it. So those are the parts that I wouldn't want to even go into, but they tried to find the line and then they gave me the spinal injection. After the spinal injection, your leg, you're not supposed it numbs your two legs, like your two legs will
Wow.
become immovable. And at that point, even if they even hit you
You
something, you
won't
won't
feel
feel
it.
the pain. But unfortunately, I could still raise my left leg because after everything, after they give you the spinal injection, they'll ask you certain questions to be sure that they can start. So I couldn't raise my right leg, but I could still raise my left leg. So it wasn't really effective for me. So I kept on telling them, I'm still feeling pain. Oh, I don't want anybody that will put me any sharp object and I will feel that pain because I told them, I can still feel pain. Doctor kept on checking, like piercing me with something. I told them I can still feel the pain. So at that point, they realized that that did not work for me. And so they injected me another drug.
Hmm.
That was the last thing I could remember.
Seriously.
I just saw myself going round and round, like it was like I don't know, but I know that at that point I think they started what I because usually I was supposed to be conscious. After the spinal injection,
But
the
it
plan
did
is
not
that
work for you.
yes, the plan is supposed to be conscious because people that have seen that have gone in, they even saw when it was removed. The doctor will show them and they were communicating. They'll be communicating with you all through. But that did not work in my case, so they had to give me the injection that knocked me off completely.
Hmm.
And I didn't know when
Went to
everything
another
happened.
word.
I didn't even get to see when it was removed and everything. And after it's 2 hours, I think after 2 to 3 hours, yes, because it's a major surgery actually. Some people could take, depending on the number, I think mine was about 13. So I think the doctor spent about 3 hours and next thing I saw myself was in the ward.
3 hours. Wow.
Yes, 3 hours. Some
So how
people
many fibroids did they remove?
13 of
13.
different sizes.
13 of different
Yes,
sizes.
and there's something I forgot to mention that during pregnancy it actually increases.
Okay. During pregnancy, the size of the fibroids.
Will increase because I heard the hormones, the pregnancy hormones. You know when you're pregnant, there's this surge in hormone. I think it's estrogen also, but those pregnancy hormones also encourage the growth of fibroid. Even though the baby's presence will try to suppress it, but the fibroid still grow.
Grows.
So definitely after pregnancy, the sides were still big. So they removed 13
So
of
the
different
biggest size
sizes.
was, can you describe
Okay,
how the biggest
I know
size?
that when I was pregnant, I got from 9 to 11.
Okay.
But during this, after the myomectomy, I think when I got my results, because there's this test you do histology. When I got the result, I think the biggest was about 9 point something centimeter. So,
That should be the size of,
should I say grape also? I don't know,
because
but
it's bigger than orange.
yes, no, it's way bigger than orange, so it was really big. It was really big, but there were different sizes,
Sizes and
different
total of 13.
yes, total of 13.
Wow.
So the rest was like my recovery, and okay, so I didn't recover immediately because when they rolled me back with me back to the ward, I could still not like I was still not very conscious. So I was just I was still seeing double and everything and but later, hours later I started feeling the pain. So I started screaming, nurse, I'm in pain, I knew I was not fully back to life, but I could feel the pain. So I think at that point they knew that the injection was already fading off.
Mm.
So immediately they came and gave me, I think that same penta, they gave me some injection, I think penta and diclofenac, and I slept off. So that was the part one. That was it. Then I woke up and I was normal. So I wasn't strong, but I could actually breastfeed. But even though it was quite painful, because okay, no, at that day I couldn't breastfeed because I could barely sit up. Although it's not like if I wanted to lie down doing it, I could, but I just was in so much pain. I didn't want to even try. But the next day, I felt better. In fact, the nurses came and told me I have to try and turn. I was going
Okay.
to aid recovery.
Recovery.
But like so you just have to also help yourself because you have to try and turn. But it's a gradual process from turning to see if you can even sit up and the rest. So my daughter did I didn't see my daughter that day, but the next day my daughter came and said because it was later when I woke up I saw what they removed because they'll give you the tumor or the mass to take to the lab so that they could actually investigate and know what it truly is. So it was then I saw how big they were. Well, it was not a sight to behold. I was like, so this is what has been in my tummy.
Can you imagine 13 of it?
This is what
13 of
it's
them, or
really
is it them or
ugly.
what?
Yes, it's quite ugly, I must say.
Wow.
To think that they brought that out from your body, it's quite ugly. So the doctor said, have you been taking herbal remedies? My doctor is very funny and very blunt. I said, doctor, why did you ask? He said, because I noticed that there were a lot of degenerations, they were scattered. I just smiled because before then I was just taking this combo I prepared for just cough. I think I had cough and catarrh then, and Judy told me what to prepare. So I didn't even know that while it was not curing my cough and
Yeah, they
catarrh,
do.
it was actually also working in another way. But it's not for the faint-hearted, like she said. I wasn't very considerate. I was not ready to go through that. So for those that can, please try the natural means. For me, when I thought about the pain I had in my first pregnancy,
So you,
I didn't want to go through that experience again because personally I was willing to go through the experience, but now it's not just about me. I have a baby. I have a baby. So imagine that I now get pregnant with that pain and I have a baby to take care of. So that's the reason I decided to just go and movie. So when he said that herbal remedy, I just smiled because yeah, I was taking, but I wasn't very consistent. So I think basically that was so I got discharged about okay, let me count, sorry. Wait oh. I think 4 days later. 4 days later, but I got transfused. Just I got my blood level was not so, but doctor said I didn't lose a lot of blood.
so they gave you the one.
Yes, they gave me because another doctor insisted that I take it before that. I still
When
needed
you
to.
start breastfeeding your baby,
I started on the next day.
the next
The
day.
next day, yes, unlike the what another doctor told me that I have to win, and but the doctor said it's fine. He said the next day. Even the day before, the morning before that surgery, I actually
You breastfed your
breastfed.
baby before you went to
Yes,
the
before I went
theater.
in the theater, and then I continued the next day. 'Cause I think I just needed that rest. Then I started eating. I know me, I was so worried. One of the reasons I didn't want to go for that surgery, I heard that you won't eat after until. Although I started with water the next day. I think I started food the next day. I be 2 days. I think the next day, yeah, doctor came and said you can eat. And then the nurse was like, no, don't eat anything now. Start with.
So was there a specific thing you were told to eat?
My doctor said I should eat anything, but the nurse said, don't eat anything, please. That please start with very little, like this thing they call agidi. You don't know the English name, but
Yeah,
it's called agidi and
pap.
pap. Agidi. So I started with pap. Then after she started to start with pap. If my boys can tolerate pap, then I could graduate to agidi.
I know someone that was rushed to the hospital when she was told you can eat anything you want. But please, when you are told eat anything, please don't eat anything you see. Oh. Start um, with water. From water, you can start taking tea. And I would advise you if you want to take tea, take lean tea, take green tea, not other beverages. Okay, not chocolate and those stuff. Start with something like tea, Lipton, green tea. Then you migrate to pap. Okay, you can also take pap even before tea. If you don't want to take tea, pap is fine before going to rice, fufu, and all of those. So I hope you started in lightweight, not just go get.
Yeah, no, the nurse said no, don't just go. Started with pap. Even the first time I took pap, I felt like I was going to throw it up, so I didn't take so much. Next time again, I try. I noticed that I even
So you
tolerated.
you felt like throwing up when you took the pap.
Yes.
So what
So
was the cause of it?
maybe my bowels were not really settled in for
Or
food
maybe the
then.
drug that
It could
could
be
it be the drug?
it could be the drug. 'Cause I remember one time I was pregnant, they gave me those kind of drugs and I threw up. But it could be the drug, and it could also be that my bowels were not ready yet.
Okay.
So I just took small. So you have to actually start with a little quantity too. So I noticed that after the night I tolerated agidi very well, like agidi and pepper
Pepper soup.
soup. Agidi and pepper soup. In fact, that was my favorite when I was pregnant. So then it was still agidi and pepper soup. So yeah, that one went down well. I noticed I took it
Now
again.
it just make me feel like taking agidi and pepper soup.
So yes, so that was what I kept taking until I left the hospital actually. So I was discharged about 4 days after.
What is after?
Yes,
Wow.
thank you.
So I want to stop this video here because you could tell us her experience and the whole stuff after the surgery, because from the little hint she told me she went through some other things. So it doesn't end in the hospital. So our next video will be her experience after her
Myomectomy.
myomectomy. Let me not
Yes.
bite my tongue. So that was fibro surgery, right?
Yes.
That's it again.
Myomectomy. Although they have
Myo
different mectomy.
myomectomy.
Yes. Although they have
And
different types.
myomectomy is fibro a surgery of what?
Fibroid surgery.
Fibro
But they have
surgery.
different type of myomectomy. So, but mine was open myomectomy. I think that's the
But they
common
have
one.
different types of myomectomy.
Yes, but
So
mine was
yours was
open.
open myomectomy.
Yes,
So what
because
makes it open myomectomy?
well, open is that they will cut you all out and take away the uterus and
So the uterus will be they'll bring out from your tummy and
yes, and so that one is actually very common because and they use open myomectomy depending on the size and position. So most people actually go through open
open
myomectomy.
myomectomy.
So because mine was big, so that's like
So
the
the one
option.
that's small, they can
So
do
the
it
some,
inside.
yeah, that's what they call is it laparoscopy, but I think there's some they use robots or some they just even use some little incisions to remove them. But the common one and the one I've seen everyone I know that have gone through myomectomy was open myomectomy. They cut you
And bring out
and bring
your
out and do this. So yes. So it's called
so for some of you that are scared to go through that process, I had fibroid and I shrank mine naturally. But she couldn't go through the process. Okay. As I used to say, you have to be disciplined. So if you want to shrink yours naturally, please stay tuned, stay glued to this channel because more will be coming on our natural remedies on how to do so many things that are very, very good for us ladies. So please, but if you know you cannot do it. I don't discourage keeping it there. If it's disturbing you, if it's not disturbing you, fine, you can leave it. But if it's disturbing you and you know you cannot discipline yourself, you cannot shrink yours naturally, I would advise you go for surgery. So our next video, this video is not ending here because we still have another section that is coming. She'll be telling us her experience after this surgery and you wouldn't want to miss that. You wouldn't want to miss that video.